anytime you hear the word metabolic health, it just goes to show that how does your body digest and absorb nutrients from the food you eat? That's all. So someone will ask, okay, if that is the case, what is the rationale or what has that got to do with me? So metabolic health is something that it affects everybody because we all eat food. So as long as you eat food, it means that you are looking at how can you process that food to get energy from that and then go by your day. So the moment somebody is metabolically unhealthy, then it means that it's either they are not digesting the food properly, they, they are not absorbing the nutrients properly, or they are not even getting to use the energy at all, and probably even packing up a lot of body fat. So there's a high spike in blood sugar, and then so much body fat, which will lead to a lot of problems. So anytime anybody is metabolically unhealthy, it means that their blood sugar is not stable. It always spikes and is never stable. Their cholesterol levels are always out of order, which means that they are going to suffer from cardiovascular health issues. They are going to have issues like cancer because it means that inflammation is never stopping. It's almost like a constant thing, constant thing. It goes on and on and on and on and on. And if inflammation never stops, it's a problem. So if somebody talks about, okay, inflammation is bad, inflammation actually is not bad. Inflammation is not bad. But what makes inflammation bad is that the moment it never stops, it becomes so unhealthy for you. It becomes a problem. And anytime you eat a food, any food you eat, you are definitely going to get a spike in your blood sugar. You are going to get um, inflammation happening. Anytime you eat, blood sugar, blood cholesterol, so many things are going to rise. But the thing is that the moment they spike, with a matter of time, they need to calm down. Like it needs to settle down, it needs to calm down. So if that doesn't happen and the spike continues and it never calms down or it doesn't get stable after a while, it means that there's a problem going on, which means you are metabolically unhealthy. So it's always important that metabolic health should be a priority for everybody because now the world is in a state where a lot of people's ill health or what makes them unhealthy has a lot to do with metabolic related issues. So what we call metabolic dysfunction or metabolic syndromes. So anytime you hear metabolic syndromes, then we are talking about diabetes, which is increase in blood sugar, hypertension, which means that your heart is under a lot of stress with drawing blood in and taking blood out. So it means that it puts your heart at risk of so many problems. Stroke, um, um, there's a whole lot of things that can happen. The endless stuff list of things that can happen if your heart is under a lot of stress from hypertension. You can have cancers, so many issues. So as simple as it is, fatty liver issues and all that. So we have to be careful when it comes to metabolic illnesses or metabolic syndrome. So that's why it's important to really make it a point to always go to the hospital and get tested, do necessary tests, because that's the only way you're going to detect any metabolic dysfunction that's happening in your body. So something like diabetes, you never see it, it never shows on you until it gets very complicated and then you start experiencing the symptoms. Most times, most people will never even notice that their blood sugar is unstable and they're having diabetes. Or you never notice that, okay, your blood pressure is getting out of hands, what we call the silent killer. Blood pressure kills you easily. Like it will kill you so easy. You will never get any warning sign, any form of information that, okay, you have um, diabetes or hypertension, or like you barely have them, even with cancers. That's why this month of October is very important, that everybody goes and have their breasts examined to make sure that you don't have any lumps growing which are cancerous, so that at least early detection will lead to treatment. And then when you have those treatments, at least you can be safe, your life can be safe, it can mitigate a lot of things than rather sitting down and then the issue starts. So it's important to regularly test your blood sugar. It's regularly important to also do blood pressure checks. I mean, this there are simple devices you should have at home now. Every individual should have a blood glucometer just at the tip of your fingertips. You can just pinch it up with to get a little blood come out, and then you can check for blood sugar levels, which gives you a fair idea of okay, how is my body regulating sugar well from the day-to-day basis. And then it's also important to do cholesterol tests to see where your cholesterol levels are, the cholesterol panels. You see the total cholesterol, the HDL, the LDL, the triglycerides, and even your cholesterol ratios. They are very important that you know all these informations about yourself, your liver function, your kidney functions. You need to check all these things because as you do them on a regular basis, you get to know how your body processes everything, any energy, any food that comes in, and as well your health of your organs. Because nobody is ever going to know that their kidneys are going to fail until it gets bad, and then one day you have to be admitted, and then maybe probably you have sudden loss in weight, and your weight is so dropped down that you don't even know that you're like there's a problem going on. You only get to the hospital before you get to know that okay, my weight is dropping suddenly. I don't understand what is happening. And then you are told that, okay, your kidneys are not functioning very properly. So it's important that on a regular basis, we do tests to check for our metabolic health. So doing a kidney function test, doing a liver function test is very important. Checking your blood glucose, your cholesterol levels, they are very, very, very important because if you don't do them, you are never going to know because there's no sign, like you don't really get a sign that comes in to tell you vividly that okay, your blood glucose is so high or your cholesterol levels are so high before you ever get a symptom that really recognize that there's a problem. Then the issue might have probably been so long gone, so far gone that sometimes it becomes so hard that we now need to use modalities like medications and other protocols to treat you. And most people who get into this state, it's actually a medical emergency, which you definitely probably find yourself in a triage where they have to find ways to stabilize you with so many injections and so many stuff to get you stable. And then probably maybe later you come back home and then they treat you. For some people, they even run into comas and stuff before they probably recover. And some people are not fortunate. They experience a stroke and then that's it. They will be deformed for life. They might be in comas for a long time and then that will lead to their final demise. So my advice here is that we should make metabolic health a very important medical um, medical importance, like where you go to the hospital regularly to check for your metabolic health. So this is where I want to talk about different tests that you can do and what is important. So somebody is asking me on Facebook that okay, what are the signs and symptoms to see if you have sugar levels very high? We know that for some people, their urine tastes sugary. That's one thing. Maybe it will be a physical thing that you might see. And so you realize that when you pee, ants can actually come around your urine. That's one thing. But those will be extreme cases, like when it's so bad. But a simple thing you can notice is you don't have control over like when you're hungry. Anytime you get hungry, you realize that you get very shaky and you are so craving for food, like you want to eat. You can't even have your appetite under suppression. It's like the moment you get hungry, you want to eat. It's like you are so craving for food that you want to eat. There's no way you can even put yourself under control. So if you are someone who, when they get hungry, they get shaky, they get agitated, you sweat a lot, it's one of the signs that your blood sugar levels might be going up and you don't have a handle on it. It means that you can't really, your body is not able to process your blood sugar very well. So it might be something you might want to do further testing to check. Now, in terms of talking about blood sugar, I know fasting blood sugar, I talked about it here. If you have a simple glucometer, you can check. But I would say that in as much as you have a simple device like a glucometer at home to check your blood sugar levels, you should make it a point to also go to the hospital and do what we call HbA1c. So HbA1c is hemoglobin A1C test. It tells you, it gives you a mean average of your blood sugar for the past 3 months. which means that it will give you an average percentage score of how your blood sugar has been for the past 3 months, which is, to me, is more accurate to detect if there is a problem going on such that your insulin production is not able to regulate the amount of blood sugar that moves through your bloodstreams on a regular basis. So anytime you go to the hospital and you go and see your doctor, make it a point that you tell him or her that they should request or they should make you do what we call hemoglobin A1C. It's very important because that's one way to actually look out and locate your blood glucose average percentage for the past 90 days, which is 3 months. So it's very important that you do such a test. It gives you a more accurate way of testing if you actually have, you're actually struggling to deal with your blood sugar. That's one test. Now, the second test I want to talk about is OGTT, so oral glucose tolerance test. It's a very good test to also do because that test is done such that it puts into account what we call postprandial. Postprandial means that anytime you eat any food, what happens to your blood glucose after? So postprandial will be, you go to the hospital, they test your blood sugar at the time you came without food. And then they feed you glucose. And then they allow you take the test again. So you take the test for different times, which will be different hours interval to see. And then it is plotted against a graph where you get to see when you took the glucose, what happened? Was there an increase? And then after having the increase, did the glucose drop down? And then was it able to stabilize after a while? So that is like one of the smartest way to actually know that, okay, your body is producing enough insulin and the insulin is able to manage and handle your blood sugar at every point in time. I hope this makes sense. So OGTT is also another very good testing modality to diagnose or predict or see if somebody actually has blood glucose problem or blood sugar problems, if you're actually probably able to notice if you're diabetic. So this gives you a fair idea of noticing to see if you have diabetes so that you're able to correct it before it happens. Now, the next thing is I want to talk about, at least these two tests gives an indication. Let me add one more test. So another test that you can do is just testing for insulin sensitivity as well. So they'll take your blood sample and see how your body releases insulin at every point in time in your blood. So such tests are done in such a way that it notices how your body regulates insulin and then the levels and everything. So that's also another way to actually test it. But definitely in the setting we find ourselves, testing for insulin itself is very expensive. So you might want to do either the HbA1c or the oral glucose tolerance test. Those are very good modalities to see if you can check for that. Now, a tip I can give somebody is that, let's say you are home and then you don't, probably maybe it's a challenge for you to do any of these tests I mentioned. What you can also do is that you can test yourself with your glucometer at home. You take your blood, you check it, and then you see the value. And then after you eat, maybe 30 minutes later or an hour later, you take the test again, you take the blood sugar test again and see what your value is. So you are able to match up your fasting blood sugar levels to your random, what we call random blood glucose level as well, so that you are able to notice the difference. And then that gives you a fair idea if it's actually something that is easy, like it's really like the level is going up or it's going down or it's getting probably handled well. So my advice is, this is something you can do at home and then you'll be able to find that out. Then the next one I want to talk about is hypertension. So simple things you can do to detect for hypertension is making sure that you check, you have a monitor, a blood pressure monitor, so that you take readings. So what you can do is that you can take two different readings. So you take a reading in the morning of your systolic and a diastolic, and then you also put into account your pulse reading. So you take those readings for morning and then evening. You do that for like a week. And then that gives you a fair idea of your readings. So then if you see that the readings you are getting for that week, the whole week is still abnormal, then I say that then it is time for you to go to the hospital. Speak to a doctor about it. Show them the readings you've done. And then it gives the doctor some form of tools to work with. So my advice to everybody is that make it a point to always have a blood pressure monitor at home. Because if you don't have a blood pressure monitor at home, it's a very dangerous thing. The world has gotten to a point where we need simple tools at home to empower ourselves in terms of our health, to give us a fair idea. Because that's one way you're going to know who you are and how your body operates. Because if we talk about metabolic health, everybody operates in a different level. As I said from the beginning, metabolic health is just how your body digests the food that you eat. It absorbs the nutrients in there, and then it allows your cells to use those nutrients for your daily bodily processes. So if you don't know yourself, you don't know how your body operates, you don't know how your body functions when it comes to metabolic health, then I feel like you are not empowered enough when it comes to taking good care of yourself, because you can only take good care of yourself as far as you understand these parameters of your own health. And as long as you know these things, they say knowledge is power. So you having knowledge about your metabolic health is very important. So doing regular testing is as important as any other thing you want to do in your life. So making sure that you can actually check and know your blood pressure levels, where they fall, what is normal to you, what is abnormal to you. If you are able to notice those things, then you go to the hospital, you show the readings to your doctor, and then at least you have some sort of information to give them. And then that helps to actually for them to better diagnose you and then give you the necessary prescription or necessary modalities to kind of reverse these issues if you should have them. So those are the two things I want to talk about. And then the next one I want to talk about is fatty liver. Most people might never be able to tell if they are having fatty liver, but one of the things you can notice is you getting a pot belly. For most people who actually have pot belly, it is the first time you can notice that somebody is actually on the verge of having fatty liver. And fatty liver happens in two ways. It's either you can have excess consumption of fructose or overconsumption of alcohol. So you can have it in both ways. It's either you are on the fructose, on the sugar end, or you are on the end of alcohol consumption. Either ways, the two of them will put you in a state of having fatty liver. So you notice that there are some people who might never be really big, but you notice that they have protruded stomachs. And those are signs of you suffering from fatty liver. And fatty liver is very dangerous, because the moment you start having fatty liver, you're going to have a lot of problems, because then it means that your liver is going to undergo a lot of stress because there's so much fat around it. And the liver has a lot of job that it does. So if you have a lot of fat running around it, then means it cannot really perform its duty very well, which puts your health at a very bad risk. You don't want that happening. So it's important to make sure that we protect ourselves from having things like fatty liver. Now, the next test that most likely will come up when it comes to metabolic is your kidney function. So kidney function is very important, because the day your kidney fails, you understand what life truly means. It brings a lot of pain, it's unbearable, and you don't want to be there. Most often than not, if you should have diabetes or hypertension, any of the two, or if you have them, it's most likely that your liver is going to fail. Your kidneys are going to fail because if you are not taking proper care of yourself to see to it that you reverse the disease or deal with it properly, it's going to put you in a very bad state, and your kidneys are going to fail. Some people actually might have genetic predispositions of having kidney disease or kidney damage. But notwithstanding, in as much as you might have genetics to that, it doesn't change that your lifestyle contributing factors are also important. Because if you should come from a family that has ties to whether diabetes, hypertension, your environment will definitely play a key role. So if you take good care of yourself, no matter what genetics you have or family history you have, it will definitely never bring you to that point of you having any of those diseases. But the moment you do all the bad things or like the unright things, you are definitely going to be predisposed to all these issues. So my advice to everybody is that we make sure that metabolic health becomes a very important thing to us, because almost right now you see everybody around us will probably be obese, have a lot protruded stomach, gain so much excess fat on your body. All these things are signs that you are not metabolically healthy. So my advice to everybody is that as we age, and as I've said already, sarcopenia is something that happens as you age and you get older. Because the moment you turn 30 and above, you lose muscle. And the moment you are losing muscle, it means you are building fat. And the more fat you accumulate on your body, the more metabolically unhealthy you are going to become, which means that you are going to suffer from things like diabetes, hypertension, cancers, high level inflammation, gastrointestinal problems sometimes. You are going to have kidney failure, liver damage. It's going to be a whole lot of problems. So my advice to everybody is that you have to make sure that you take good care of yourself and not gain so much excess fat as you get older. It's definitely going to happen, but if you've actually been somebody who really follows my content, I always say that as long as you take good care of yourself and you do the necessary protocols, which is eating highly nutritious foods, making protein a priority, weight training, walking around, and sleeping well, avoiding alcohol or limiting it, you're actually going to be safe. So it's important that metabolic health should be something we take priority in, we take an interest in, because the moment you are not taking proper care of yourself, you are definitely going to suffer from metabolic dysfunctions, and it's going to cause a lot of problems for you. So it's important that we all take good care of ourselves, eat right, get enough rest, exercise as much as we can, and prevent ourselves from getting metabolic illnesses or metabolic dysfunctions. So it's important that we take good care of ourselves. So that's my submission when it comes to metabolic health and some of the little things you can do at home to take good care of yourself.